my name is Lisie Garza, and today I will be talking about a stimulant known as Provigil, or around the world it is known as Modafinil. This is a drug that is used as a cognitive enhancer, or also known as a smart pill. Provigil is a wakefulness-promoting agent that was initially approved in 1998 as a treatment for narcolepsy. Since then, it is currently under review for treating ADHD. Along with the use of other medications, it is able to treat obstructive sleep apnea and shift work disorder as well. Provigil is also an inhibitor. It inhibits dopamine uptake and as a result increases extracellular dopamine levels. To understand this drug a little bit better, we will begin talking about the pharmacokinetics. The drug is first administered into the body internally in a tablet form. The pill comes in two different sizes, 100 milligrams and 200 milligrams. It is recommended to take 200 milligrams per day in a single dose in the morning. 400 milligrams per day is the maximum you can take in a single dose. Once the drug is administered, it is then distributed through the body in the plasma proteins. 60% binds to these proteins. It is then metabolized in the liver and excreted through the urine and 1% in the feces. The half-life for this pill is 15 hours. The peak is at 2 hours. The side effects for this drug are as follows: headache, nausea, chills, dry mouth, nervousness, anxiety, and insomnia. A different source added back pain, dizziness, flu syndrome, and anorexia. This drug is also not recommended for children under the age of 16. As you may see on the screen, there are many drugs that interact with Provigil. We are not going to go over this whole list, but we are going to highlight just a few. If you take methylphenidate and dextroamphetamines alongside Provigil, it may delay the absorption. It may also reduce the efficiency of steroidal contraceptives up to 1 month after taking it. Provigil is also not recommended to be taken with alcohol. Moving forward, we are now going to look at what research says about Provigil. This first study was done in the year 2001. They had 3 study objectives. The first one was to compare the efficiency of modafinil and an active control of caffeine. The second thing that they were looking at is whether modafinil effects are dose dependent. And lastly, they looked at the extent to which both agents maintain performance and alertness during circadian trough. Results showed that modafinil doses 200 and 400 milligrams had similar effects to caffeine. They also suggested that they did not have any advantages over caffeine for improving performance, but that both of them initially improved performance. The next study was done in 2004. This is the first study to provide evidence that modafinil can indeed enhance physical performance. For this study, the researchers used 15 healthy males that were untrained athletes but familiar with exhaustive exercise. Results showed a 22% improvement in time to exhaustion. This would provide an advantage during sports involving such high-intensity exercise efforts. The researchers also noted that there was no physical side effects reported by subjects during the study. The only concern that the researchers had for modafinil is that it increases the core body temperature during rest and exercise. This could be potentially dangerous to those who take the drug. This third study done in the year 2008 is based off the study that was previously mentioned. They found no significant differences beyond the temperatures, but they also only used 100 milligrams of modafinil in their study. Lastly, in 2007, modafinil's effects were compared to the effects of D-amphetamines. The researchers found in this study that they have very similar effects. Researchers were also concerned for potential abuse in the future. The study used 700 milligrams. There were substantial results. In the end, the researchers concluded that modafinil increase the performance just like D-amphetamines do in individuals. Due to substantial results in research, modafinil has been banned in all high-level sports. The only exception is in the NCAA, and that is with medical proof of ADHD.